Thanks for asking me to do this video for OncoAlert. I'm going to talk about IMvigor011, which is a randomized phase 3 study in urothelial cancer. It's in the post-cystectomy space, so those patients with operable disease and no evidence of radiological metastatic disease. And in this space, we tested atezolizumab, which is a PD-L1 inhibitor, versus placebo, but we didn't do it in an all-comer population. We tested it in a specific ctDNA positive population using the Signatera assay. And in this space, about 40% of patients are positive and 60% of patients are ctDNA negative. Why did we do the trial? Well, there was a previous study called IMvigor010, and in this trial, we showed the negative patients had about a 30% chance of relapse, but there seemed to be no benefit associated with atezolizumab, where in the positive patients there was a significant benefit. So it appeared prognostic and predictive in exploratory analysis. We asked the question, can we do this prospectively and prove that's the case? So we embarked on this huge trial. We screened about 800 patients to randomize 250. We tracked 370 ctDNA patients who are negative. The trial design is not just at that specific time point post-surgery. So we do the first test, and if that was negative, we then screened patients for a year. And if they became positive at any point, they were allowed to be randomized. But if they remained negative, we didn't give them any treatment, and we followed those patients up. What did we show? Well, in the 250 random patients who were randomized, we showed a significant disease-free survival advantage, a significant DFS advantage. We also showed a significant overall survival advantage with a hazard ratio of 0.64 and 0.59, respectively, benefiting atezolizumab. There's never been a positive adjuvant bladder cancer OS trial before. None of the other previous trials have achieved OS, so that's the first time we've done that. And what about those negative patients? Well, in the negative patients, we showed they had really good outcome. The patients who were negative and remain negative, the relapse rate, probably about 10 to 15%, and OS, well, it's a bit immature at the moment, but only about 5% of patients dying of bladder cancer. So we've, I think, successfully identified a subgroup that needs therapy. Also, another subgroup which we can spare therapy, who almost certainly will not end up benefiting from immune therapy. The risk is low, and we know in 2 previous trials it hasn't worked in that population. Where do we go next with this? Well, I think this does influence practice. There's a question about how quickly we can roll out this test from a global perspective. I think that's relevant. I think from my perspective, this is a new personalized approach to urothelial cancer, which we have not really been using in this space before. And it's also apparent to me that I think this is the first time with immune therapy that we've done a trial based off ctDNA where we can select patients at risk, give them therapy, and deliver an overall survival benefit. I hope this video was successful and you enjoyed it. I feel I've talked a bit quickly. Thank you very much.